All right, good morning, everyone. Nice to see everybody. We are going to spend some time this morning looking at prior legislation and reports due to the committee. And so we have Jen Carby and Katie McClinn here. And one of the reasons that we're doing this is, again, about our role of oversight and accountability. So one of the things that we have a responsibility to do is not just pass bills, but to see if the bills are being enacted as we have intended them to be enacted. And and also in the course of doing our business, you'll see, if you haven't been around for a while, that we also ask for a variety of different reports. And those reports sometimes are to enhance and provide additional information, potentially for further action, or to look at, what has been the impact of the bill that we passed. So I asked Katie and Jen if they could review some recently passed legislation and reports due to the committee. And welcome and thank you for being here this morning.
Thank you. Thank you.
All right. I don't think we've done introductions for both of you now, so I don't think we need to do that. But
just jump in.
Yeah.
Okay, good morning. Katie McClinn, Office of Legislative Counsel.
And Jen Carby, Office of Legislative Counsel.
So you'll see two documents on your committee page. The first document, I don't know if it's the first, I don't know what order they're listed in, but one of the documents is a slide deck. And this, Jen and I are going to go through first. This is all of the bills that moved through this committee during the 23-24 biennium. So we'll spend a little time there. And we'll try to save some time because the other document is a list of all of the reports that are due to this committee. It's extensive. So we'll save some time. But what's nice about that document is you'll see that if the report has come in, we've hyperlinked it. So if you're curious to learn more about a particular report, you have quick access to it. Okay, so
and can I just add, not only if you are curious, but if that relates to the department for the budget area that you've been assigned, I'm actually asking you to go and take a look at those reports that are related to the department that and the budget area that you've been assigned. It is difficult for everybody to try to read all of those. So if you want, certainly read whatever you want to read, but really please do read and concentrate on the ones that are reflective of the area that you've been assigned. Thanks.
And I will just note as we start to go through these bills, while Katie and I are probably the main attorneys you see in here, there are other attorneys as well. And so we may be covering some that we did not work on. So we will do the best we can to answer any questions, but we may have to get back.
Okay. So Act 2 of last biennium was a bill to correct an error. There was a bill and it asked for legislative approval of payment reform and conflict-free case management. Oh, yes, I did. I thought it was up. I'm sorry. Take 2. There we go. Do you see it? Yep. I guess I'm out of practice there. I'm a little rusty. Okay. There we go. Okay. So here's Act 2. This removed language that required legislative approval for payment reform and conflict-free case management provisions for developmental disability services provided by Dale, and instead asked for Dale to present its proposals related to payment reform and conflict-free case management.
Next, we have Act 10, and this was an act entitled an act relating to removing the residency requirement from Vermont's patient choice at end-of-life laws, and that's exactly what it did. Under prior law, the state's, we call it in statute, patient choice at end of life. Some people use medical aid in dying, death of dignity, physician-assisted suicide, lots of different terms for it. But it had a requirement that the patient using it had to be a Vermont resident. There was some legal action both in Oregon and then also in this state. And as part of that, in response to that, although there was not a court decision, but the decision here was made to remove the requirement that the person must be a Vermont resident in order to use the process set out in statute.
Yeah, go ahead, Doug.
Thank you. So I understand these were all passed by this committee last year. Are they also a set of laws or bills that were passed by the House or made it into law or?
Yes, so all of these that you'll see until we
Okay.
get to the very end are acts.
Yeah.
Yes, there is one vetoed bill that we will get to at the very end. But yes.
Okay. Next is Act 22. I apologize. This is a 2-slide.
Very long.
I know, I was trying very hard, but you did so much in this act that I wanted to highlight a lot of things. So first, you updated the unused prescription drug disposal program to include needles and syringes. And you required the Department of Health and the Blueprint for Health to facilitate regional stakeholder meetings regarding public needle and syringe disposal programs. You required the health department to distribute opioid antagonists and to establish kiosks for opioid antagonists. You removed a few requirements related to opioid antagonists. First, that a healthcare professional can only prescribe and distribute opioid antagonists if the recipient has completed a health department approved training. That was removed. And also you removed the requirement that an individual has to call for emergency medical services after using an opioid antagonist. This act prohibited a health insurer or other health benefit plan offered by an insurer or pharmacy benefit manager on behalf of an insurer from using step therapy, fail first, or other protocols requiring documented trials of medication before approving a prescription for the treatment of substance use disorder. And similarly, you had a similar requirement with regard to DVA, Department of Vermont Health Access. You prohibited them from requiring a health provider to document a patient's adverse reaction to a medication prior to prescribing an alternative medication for opioid use disorder. And you allowed, or the act allowed, controlled substances for use in opioid use disorder treatment to be prescribed via telehealth in accordance to federal requirements. So. Thank you. Almost there. This act also required the Agency of Human Services to provide coverage to Medicaid beneficiaries for medically necessary medication for opioid use disorder when prescribed by a healthcare professional practicing in the scope of the individual's license and participating in Medicaid. The act required, pending the approval of the Drug Utilization Review Board, it required AHS to cover at least one medication in each therapeutic class for methadone, buprenorphine, and naltrexone without prior authorization. It directed DVA to amend its rules to enable healthcare providers and office-based treatment programs, OBOTs, to prescribe 24 milligrams or less of a preferred medication for buprenorphine without prior authorization. And there are numerous appropriations in relation or from the opioid settlement fund. So that was all part of Act 22. That was a big one. Act 49, here's a small one. This directed the Department for Children and Families to submit a report containing actionable phased plan that estimates the amount needed to remove the rateable reduction in the Reach Up program. The Reach Up program is the program that's the Vermont's version of TANF, Temporary Assistance for Needy Families. To calculate how much an individual's benefit is, first the amount is calculated and then it's reduced by roughly half. That's called the rateable reduction. And so this was a report to see what amount was necessary not to do that reduction of the TANF benefit.
Yeah, go ahead, Doug.
Maybe this isn't the time, maybe it's not, please just let me know, but what is the rationale behind starting with a rateable reduction of 50% once the determination is made?
That'd be a matter of policy is what I believe the witnesses would say. It honestly is just about finances. It's about how much money there is. Um, we've made various attempts to try to reduce and eliminate and stagger out of the rateable reduction, but essentially rateable reduction means that we, meaning the state, determines how much a person needs to sustain themselves and their family, and then we say, we'll give you half of that. That's what it means in plain language.
And the pot of money for Reach Up is generated out of state revenue, so flows through the federal government and we then distribute it.
There's a combination of state and federal funds in that.
This next Act 58, an act relating to household products containing hazardous substances. I believe you worked on this with Mike O'Grady, so the members that were here last biennium already have more expertise in this particular act than I do. So this established an extended producer responsibility program for the collection and disposition of covered household hazardous products. It prohibited a manufacturer from selling covered household hazardous products unless the manufacturer participated in a stewardship organization that was working towards having an approved plan. It required any stewardship organization representing manufacturers of covered household hazardous products to coordinate and submit to the Agency of Natural Resources a collection plan for review. And it required that the agency review and approve those plans, plan amendments, and registration of the stewardship organizations. Next, Act 81. This is an act that actually we were sort of referencing when Jen and I were last here, giving you kind of an overview of how Ledge Council works and how to read a bill. So this is an act that has two different topics in it. The first topic was an act relating to adult protective services. And then what was attached to it was language about the emergency housing transition benefit. So the first, I have 3/4 of the act, was an effort to modernize adult protective services program, bringing definitions in line, procedures in line with what's happening in other states. And then the last quarter of the bill created an emergency housing transition benefit that has since expired. But the concept behind that was transitioning people who had been receiving an emergency housing benefit during COVID back into the more traditional emergency housing program.
Next, we have Act 88, which dealt with remote and electronic processes for executing an advance directive. So an advance directive is a document that an individual can fill out that it does a couple of things. It allows them to appoint an agent or agents to make healthcare decisions for them if they're not able to make their own decisions. And it also allows them to express what kind of care and services they do or do not want at the end of life, or if they're otherwise unable to make their own healthcare decisions. So this act made permanent some remote witness authority for advance directives that was originally enacted during the pandemic when it wasn't necessarily possible for people to be in the same location to witness principal signing an advance directive. And this made that a permanent option to have remote witnessing. The remote witness can be on a live interactive audio video connection, so like Zoom or Skype or something like that, or on the telephone. It also made permanent the remote authority.
I don't understand.
Very complicated.
My explanation wasn't sufficient. So it also made permanent the authority for we sometimes refer to as the explainer, which is a neutral, independent person who explains the nature and purpose of an advance directive if an advance directive is being executed by a person who is a resident or being admitted to or a patient in a hospital or a nursing home. Somebody else neutral needs to explain to them what it is, make sure they understand what they're doing. And so this makes permanent the ability for that explainer also to be remote, either by live interactive audio video connection or by telephone. It also enacted some additional in-person and remote witnessing provisions around the execution of what we refer to as a Ulysses clause. And that is just, it's an optional provision in an advance directive where a principal can specify certain, a specific agent and allow that person to authorize or withhold care over the principal's objection if the principal doesn't have capacity. So that was an existing optional provision, and this put some additional parameters around both in-person and some remote witnessing provisions, but treating it differently than the rest of an advance directive, with ensuring more effort to ensure that the person is clear on what they're doing. And then finally, it allowed all the parties involved in signing an advance directive to use a digital signature, which helps to execute that or to implement the remote.
Next was Act 115, an act relating to mental health response service guidelines and the safety of social service and home health providers. This act was a bit of a grab bag. It started with just the items in the first bullet, and various different items were added as it moved through the process. So first, it required the Department of Mental Health to develop guidelines for municipalities, recommending best practices with regard to de-escalation for both crisis and non-crisis situations for a mental health provider responding to a scene. Second, it required the Agency of Human Services to work with the Vermont chapter of National Association of Social Workers to convene one or more meetings about social worker provider safety with community-based social service organizations and other stakeholders. And then there was language that they being the National Association of Social Workers, can come back to the General Assembly with a presentation on the results of those meetings. The last two bullets have to do with home health agencies. The first bullet discusses how home health agencies are authorized to not provide treatment to an individual who was previously discharged due to some safety concern for the home health provider that was coming into the house. And it allowed the home health agency to decline services in those certain circumstances if the risk couldn't be mitigated or eliminated for the home health worker to come back into that house. And then related to that, it required Dale to provide various data points to the General Assembly February of this year. So in consultation with the home health agencies, providing an update on the number of those safety discharges made during the previous year, the number of individuals denied subsequent admission or services from a home health agency due to a previous safety discharge.
Next is Act 119, an act relating to re-envisioning the Agency of Human Services. And this directed the Agency of Human Services in collaboration with all of the commissioners whose departments fall under the agency and in consultation with relevant stakeholders to consider options for re-envisioning the Agency of Human Services. There are 6 departments in it. It is more, I think more than half of the state budget flows through the Agency of Human Services. So there was interest in having the agency kind of reflect on its organization and delivery of services and see if there were improvements that could be made. There's a status update that's due in a couple of weeks and a final recommendation due by the end of this or later this year.
Do you recall, Jen, on the status update, is that is it written? Are they supposed to do a
I
presentation?
think it can be either.
Okay.
We'll look at it when we get to the list, but I think it was phrased in a way that could be either a report or a
Okay.
presentation.
Okay.
I think there was maybe more interest in kind of hearing about it than in,
Yeah, I remember like something about
yes.
don't ask for another written report. Yeah, okay.
This was an act, 126 is an act you worked on, the members who were here last biennium worked on with Michelle Childs, an act relating to the establishment of the Psychedelic Therapy Advisory Group. It created this working group to look at existing research on the cost benefit profile of using psychedelics to improve mental health and to make findings and recommendations about whether it makes sense or is advisable to establish a state program that would allow healthcare providers to administer psychedelics in a therapeutic setting and the impact on public health of allowing individuals to legally access psychedelics under state law. There was a report due in by November 15th, and it is in and is posted on the General Assembly website. There's a link here and also in the reports list when we look at it.
Next was Act 131, an act relating to consumer products containing perfluoroalkyl and polyfluoroalkyl substances and or other chemicals. So PFAS, also known as the forever chemicals. These are chemicals of concern due to links with human health and also their presence in the environment. So this bill prohibited a manufacturer from selling, offering for sale, distributing for sale, or distributing for use in the state a cosmetic or menstrual product containing certain chemicals or chemical classes, including PFAS. It also prohibited a manufacturer from knowingly selling, offering for sale, distributing for sale, or distributing for use in the state a cosmetic or menstrual product containing 1,4-dioxane or exceeding 10 ppms, parts per million. It imposed restrictions on the sale and distribution of previously unregulated consumer products containing PFAS, including artificial turf, incontinency products, juvenile products, cookware, and textiles. And these prohibitions are kind of happening on a rolling basis, so not all of them are necessarily in effect right now. It also directed the Agency of Natural Resources to propose a more systemic program for the regulation on the sale and distribution of consumer products that contain PFAS. And that, I believe, is the report that your members are listening to now.
And it just as a FYI, so the Environment Committee is going to take up a bill with regard to this that the Agency of Natural Resources is proposing, and then we will have it in our committee as well when they're done with it. So, yeah, go ahead, Doug.
Question regarding the imposition of the restriction on sale and distribution. Is that just in-person sale or distribution?
Not necessarily. I don't think the language specified that it was only in-person sales. It's sales in Vermont.
That could include online. Okay, thank you.
Yeah, go ahead, Ann.
It's a question more for the chair. Is this the subject that we all got that frantic email about yesterday? No, all right, never mind. About it not including something that it should have an A&R.
Oh, A&R is wanting to change the a significant definition.
Yeah, okay.
And
Regarding seeds or alcohol or something. No, I
don't know. Seeds are
Okay.
planting, I'm not sure.
All right,
Yes.
sorry.
What's A&R?
Agency of Natural Resources.
Thanks.
Yeah, I'm sorry. And we do use a lot of acronyms.
I'll learn them. I'll learn them.
Yeah, ask if, we pop one out that doesn't make any sense to you. And Lori sent in last week's email, she sent the whole list of acronyms that we commonly use.
I'll find it and print it out. Thank you.
Yeah, just as an FYI, because we do use a lot of acronyms here.
Not to bother everybody.
Oh, no, it's not a bother.
Okay, next, Act 137, an act relating to civil commitment procedures at a secure residential recovery facility and a psychiatric residential treatment facility for youth, and civil commitment procedures for individuals with intellectual disability. So this is what had previously been titled an act relating to a forensic facility. Just to refresh your memory, the title was changed when the bill did not include a forensic facility at the end. A lot of the changes made in this act are the jurisdiction of House Healthcare. You sort of shared custody of this bill with another committee. But for what it's worth, this enabled the Department of Mental Health to seek treatment for certain individuals at a secure residential recovery treatment regardless of if they had previously been hospitalized. Prior to this, they had to have first been hospitalized to move to the secure residential treatment facility. This also authorized the use of emergency and voluntary procedures like seclusion and restraint, and court-ordered involuntary medication at the secure residential recovery facility. The act made miscellaneous changes to civil commitment processes for individuals with a mental health condition, including modifying existing language authorizing initial commitment for an indeterminate period to a period of 90 days that is consistent with the practice that was already happening, but the legislative language didn't reflect that. It authorized treatment of a new type of facility, and that facility is a psychiatric residential treatment facility for youth, a PTFY, and established a licensing requirement for the operation of this new type of facility. Related to the jurisdiction of this committee, it updated the civil commitment procedures for individuals with intellectual disability. The act authorized a proposal for alternative options for secure community-based residents or residences to treat certain individuals with intellectual disability who have been charged with a crime and found incompetent to stand trial or adjudicated not guilty by reason of insanity, and who require a more secure level of care than is currently available. So it authorized Dale to come with a proposal for this population if they have a proposal.
So that'd be something that we'll ask about during the FY26 budget process and whether or not they're doing that or not. And so for people new to the committee, sometimes individuals with an intellectual disability are found incompetent to stand trial because they can't participate in their defense, essentially. And so they may be committed to the Department of Disabilities, Aging, and Independent Living. And the department came and asked for the ability to essentially have a secure residential facility. And there was a lot of debate in this committee about that, and we declined to authorize what they asked for, but offered them an opportunity to look at something different and community-based. But what it means is that a person who is likely to have committed a crime but can't stand trial for that crime receives the supervision of under Dale, the Department of Disabilities, Aging, and Independent Living. And they don't provide services directly. They contract with them through the designated and specialized service agencies. So that's a little bit of background for that, Ann.
Yeah, just to add, I think one of the original proposal, which led to really big concerns on this committee as a red flag, was to have a facility, a secure facility that included both people not competent because of a psychiatric disability and those not competent because of an intellectual disability, which we did not think belonged in the same treatment facility. So that was one of the big red flags that made us first say, let's slow down.
Yeah.
Yeah.
And then the last piece on this slide has to do with the possible creation or implementation of a competency restoration program. So the concept there is just, as Madam Chair is just saying, sometimes somebody can't stand trial because they're found not competent to stand trial. A competency restoration program would be used to help that individual regain competence so they can stand trial. This just asks for a fiscal estimate for implementing a program, but the program would be for individuals with a psychiatric disability and by reason of intellectual disability that they were found not competent. Oh, yeah, go ahead. Ann.
Just a quick heads up, because on our budget item, the concept of the psychiatric residential treatment facility will be part of our budget comments later today.
Okay. Act 154, an act relating to child abuse and neglect investigation and substantiation standards and procedures. I believe you worked on this with Ben. This modernizes the Department for Children and Families investigation and substantiation standards and procedures when handling complaints related to child abuse and neglect allegations. It raises the evidentiary standards to substantiate an allegation to a preponderance of the evidence standard and enhance timelines to respond to investigation and substantiation reviews. It required DCF to use best efforts to obtain the person's current mailing and email address so it can better notify those persons. Bless you. It aims to ensure broader disclosure of records to individuals requesting reviews or appeals. Mandates the adoption of rules related to placement on the Child Protection Registry, standards for determining child protection level designations, and for notice and appeal procedures for alternatives to conduct substantiation. And lastly, it required DCF to author reports creating a model policy related to confidentiality for storing child abuse and neglect investigation interviews and related substantiation determinations, categories, and thresholds for registry placement.
Go ahead, Doug.
Thank you. I don't know if I'm mixing issues here, but I believe, heard testimony about the high level of reporting in Vermont that takes place of suspected cases of abuse or neglect, but that our numbers, as far as substantiated, pretty much match national levels. And perhaps there was some discussion or reference to potential changes for mandatory reporters. Was that part of this discussion at all last year?
It was not, well, I shouldn't say it wasn't. Part of this discussion was about really trying to bring some, I guess what I would say, updated procedures so that people, so that there weren't undue reporting and investigations of people, one, without their knowledge, and two, with circumstances that didn't necessarily warrant what we would call a complete investigation. So there was a new process that requires an that looks at an assessment so that you can review, but not necessarily open an investigation, a formal investigation. So I think that what the mandated reporter thing, that was in the context of judiciary's role in determining who's a mandated reporter. And yes, we did hear some testimony about like, well, maybe there should be some modification to that because Vermont seems, at least the witness felt like Vermont was an outlier with regard to the number of reports of child abuse and neglect. But as you said, the substantiation level was more consistent. So are there more reports than necessary being made? And I think that's probably a judgment call, to be honest.
Okay, thank you.
That's it. I'm just going to say, Doug, that would be an example of sort of a cross-jurisdictional thing. So that judiciary would definitely have a role in that, and then we would probably have a role in that too. So, you'll see there's things here that definitely sort of cut down the line of our committee and only our committee. And then, like all the other committees in the building, when we did our little orientation, we went through all the other committees and we found ways that we would probably have interaction and jurisdiction with every committee in the building. So
Until you reminded me, I couldn't recall whether that took place in this room or the pavilion, but it was.
It was in the pavilion, yeah.
A joint committee here.
Yeah.
Act 163, an act relating to the systemic evaluation of recovery residences and recovery communities. So here, when we talk about recovery residences, we're meaning residences where individuals are recovering from a substance use disorder. This directs the health department to develop and recommend a certification program for recovery residences operating in the state that choose to obtain the certification. This act requires the health department to complete an assessment of certified and non-certified recovery residences, including the creation of a comprehensive inventory of all of the residences in the state, the results of which have to be submitted by December of this year. And then there's a time limited provision for recovery residences with regard to how to exit or discharge a person from a recovery residence. And this is sort of a short-term provision because it anticipates that there are going to be recommendations about a more permanent certification program coming online. So between July of last year and July 1 of 2026, it enables a recovery residents to immediately exit or transfer a resident if certain conditions are met, including that prior to any exit or transfer, the recovery residence has developed and adopted residential agreement and obtained residence written consent. Second, that the resident violated the substance use policy in the residential agreement or engaged in acts of violence that threatens the health or safety of other residents. And third, that the recovery residents provided or arranged for a stabilization bed or another alternative temporary housing. And lastly, this act directed data collection regarding this short-term exit transfer policy.
Was there a date on that? I mean, is that like annually? Is it like?
I think
During
you
this
get
transition
it
process?
twice during this process. So it's annual, but only 2 years.
2 years, yeah, because it's a transition process.
Yeah.
Yeah, okay, thank you.
Act 164, an act relating to public health outreach programs regarding dementia risk. This directed 3 departments, the Health Department, Department of Mental Health, and Department of Disabilities, Aging, and Independent Living to provide education on specific topics to healthcare providers and to increase public awareness about Alzheimer's disease and other types of dementia as part of existing public health outreach programs. It also directed the Health Department to provide a presentation to relevant standing committees of the General Assembly describing the public health impact of rare diseases in Vermont and the department's role in addressing rare diseases statewide.
Excuse me, this is Act 178. This is another one you worked on, or the members from last planning worked on with Michelle Childs. This is an act relating to a harm reduction criminal justice response to drug use. And it established statutory requirements for an overdose prevention center. It talks about what overdose prevention center services would include, which is, among other things, providing a fixed or mobile site that's supervised by healthcare professionals or other trained staff, where someone who uses drugs can consume pre-obtained drugs, doesn't supply drugs, but they can bring their own, and medication for substance use disorder and use those in that setting. It also provides limited criminal and civil immunity to users of the center services and the people and entities who operate the center, as long as they're doing so in accordance with rules adopted by the Department of Health. It appropriated funds, 1.1 million, to the Department of Health in fiscal year 25, which is the year we're in now, from the Opioid Abatement Special Fund for grants to the city of Burlington to establish an overdose prevention center after the city submitted a grant proposal approved by the Burlington City Council, and that met the requirements of statute as enacted by this act. It requires the health department to provide status reports on the distribution of grants to Burlington. There were 4 quarterly reports due October 1st, January 1st, April 1st, and this coming April 1st and July 1st. The January report was submitted and is posted on the General Assembly's website. It also required that by December 1st of 2024, the health department contract with a researcher or independent consulting entity that has expertise in certain areas to study the impact of the Overdose Prevention Center pilot program. And there are interim reports due annually, with the last final report due in 2029. And that first interim annual report was submitted and is posted on the website.
And committee members, but that was under our O&A. Last week, we got an update about the Overdose Prevention Center in the city of Burlington, and the Commissioner of Health testified on that. So happy to say, even though there were a lot of dates in that one, the health department has met all of the dates so far, which is great.
And then the last bill, I think, is just a bill. So this is the one that was vetoed and did not become an act, but this committee spent a lot of time working on it, so we wanted to include it. This was an act relating to banning flavored tobacco products and e-liquids. This would have made a number of changes to laws relating to tobacco products, tobacco substitutes, which is statute language for what people refer to as e-cigarettes or vapes, e-liquids, which is the liquid that goes with a tobacco substitute, and tobacco paraphernalia. And some of those changes it would have made would have been banning the retail sale of flavored tobacco substitutes, flavored e-liquids, and menthol flavored tobacco products beginning on January 1st of 2026. It would have prohibited the sale of discounted tobacco products, tobacco substitutes, e-liquids, and tobacco paraphernalia. It would have allowed minors 12 years of age or older to consent to treatment for dependence on nicotine, tobacco products, and tobacco substitutes, so to seek cessation assistance. It would have directed the Health Equity Advisory Commission to include in its annual report, its 2025 annual report, whether the retail sale of menthol tobacco products, including menthol cigarettes, should be banned in Vermont, and that report was due to come in before the ban would take effect. It would have required the health department and others to prepare a number of reports and to develop options for a diversion program for persons who are under 21 to be diverted to a tobacco cessation program instead of receiving a fine or a civil penalty. And it would have created a new investigator position at the Department of Liquor and Lottery to investigate and enforce laws on direct-to-consumer sales and delivery of alcohol and tobacco products. As I mentioned, that bill was vetoed, and so it did not become law.
Thank you. Thank you very much. Just as a FYI on that last one, looking at the investigator position, and it might be helpful for people to know, and just to jog people's memory, that the Attorney General's office actually is doing some, they testified to their activities, particularly around online sales of banned products that are already banned in Vermont. That's something that they're very active on. And the Attorney General, as I understand it, is a lead in the in the National Attorneys General group on this topic. So we may be hearing more from her during the course of the session. So any sort of like general questions from people around? As you can see, we had a pretty busy biennium, and that was in addition to working on all of our budget stuff, which takes up quite a bit of time in this committee. So any questions, thoughts? And we also did a GA bill that didn't pass, but for which a big chunk of it actually ended up in the budget bill. We spent weeks on that bill, and we'll be getting started on that again here again. So sometimes things take a very, circuitous route. And we have had that happen multiple times for things that pass out of a policy committee. If they have something to do with the resources of the state, they may end up in the budget bill. If certain committees and certain parts of the building decide that that's, the avenue they're going to take. So it's an interesting thing. And as Ann was pointing out, there are elements of bills that start out in one direction, end up getting something else tacked on to it. I think we gave an example of that with the Child Care Bill, Act 76. It started out as a wholly different bill and ended up on a workers' compensation bill. So things like that happen, and we just need to be prepared for it. And when you are a member who is tasked with following a bill, you're the reporter of the bill, you'll follow it through all its machinations through not only this body, but the body downstairs in the Senate. So that's something for you to all look forward to. Okay. You wanted to do run through the reports? We have that on our website as well. It's a lot of reports, yeah. I think the other thing, to note is Lori has, on our committee's webpage under reports and resources. So you can find all of these on the big legislative page, but also ones that are of particular interest to us. Lori has pulled from there and put under our reports and resources, because then you don't have to go looking through everybody else's reports to find ours. So
She will continue to.
thank you, Lori. There are more. Yes, there are more. Yeah. But thank you for doing that, Lori.
Okay, so as the name of this document suggests, these are all of the reports that are due to this committee. These reports, we've tried to organize it chronologically by when they're due. So you see, we start back in July, right after the General Assembly adjourned. And on the final page, you'll see that there are some reports, sort of future reports, so you know what is coming to you. But to start off with, there's language in the budget asking the Department for Children and Families to come up with a plan around the development of emergency shelter and permanent supportive housing capacity. And this is to be followed up by 2 progress reports, which you've received. So this first item is that plan.
Next is quarterly Choices for Care report. Choices for Care is a program that provides home and community-based service options for people who would otherwise be only eligible for long-term care, Medicaid, in a nursing home. And this actually did not find that these Choices for Care reports had been submitted. So we may want to follow up with the agency, but they are supposed to be sort of a longstanding.
It's you, Dan.
Dan and Todd, that's your assignment.
Just thinking how that would be helpful. Right now.
You will see a different one further.
The budget also asks for monthly updates on general assistance emergency housing, so you'll see those throughout this list. So the next 2 items are the July and August iteration of that report. And then on September 1st, there's an annual reporting requirement from the Agency of Human Services on the General Assistance Program. So if you recall 2 weeks ago, when we talked about GA, we talked about how GA is broader than just emergency housing. So this report captures sort of the broader GA program, not just general assistance. Next is from Act 76 was the Child Care Act. There was a reporting requirement from the Department for Children and Families on special accommodation childcare grants. So that did come into you on September 1st. The next item is the first of 2 progress reports on the development of emergency shelter and permanent supportive housing capacity from the Department for Children and Families.
Then we have an annual report from the Department of Disabilities, Aging and Independent Living on the calculation and allocation of savings in the Choices for Care program. So this is related, but not the same as the quarterly Choices for Care report. This report is looking at the use of any funds remaining after the appropriation has been spent for the Choices for Care program, less a 1% amount that is held in reserve in the event that there is a surge in demand for highest needs, the high and highest needs group. And I did just take a quick look at this one. It's very short. There were no savings. So after the appropriation or after the program expenses, there was less than the 1% reserve remaining. So there were no savings, quote-unquote savings to be reallocated.
See this for a second.
Yes, of course.
The department's thing. I have a question.
You want the.
Yeah, just quick points. So they, Choices for Care carry forward plan from state 24 to 25 following the CFC statute. 1.7 million. I was questioning whether or not they were.
24 to 25.
Yeah, but they said there were no savings.
So what's
So what's the carry forward?
24 to
That's you.
Right, we're in 25
Right.
now, so.
And they said at the end of 24, there were no savings. There was none left.
Um,
I mean, I'm not expecting you to answer it.
Right.
I'm thinking, when I saw that yesterday,
Pricing sounds different. Are they talking about something
I don't know, but
different than?
have you asked about that, one, Dan? Just refer, I'm just thinking, to refer back to the report. I remember the report saying the summer, there were zero savings. And because they spent, you should look at that report, Dan, because they also spent money on EFR to bring it down to zero. Anyway, emergency financial relief for nursing facilities. So I don't know what that 1.7 million is. That was, they said per language, CFC language. The only language I know about CFC is the
Right.
savings language. So I was wondering if they were asking for money to create that 1%. Do you know what I mean?
Yeah.
So, okay, we'll have to find out. Yeah, go ahead, Esme.
This could be a bit nitpicky here and maybe not relevant to this conversation, but was there some discussion last term about the use of the word program when it comes to the GA?
I always put it in quotes because it's not really a
Yeah.
program. It's a benefit.
Yeah, and in all the reports, it's again referred to as a program, so I wonder if that was a part of the discussion or.
It is, I can't remember what it actually says in the budget bill.
Yeah.
They will tell you also, DCF will tell you, they look at it as a financial benefit.
Yeah.
We were attempting, don't fall.
Oh my gosh.
We were, both the House and the Senate were, attempting to put in place a bona fide program. The Senate appropriations, it passed out of Senate Health and Welfare, passed this body. And Senate appropriations decided that we needed essentially more time to review and have the task force do their work. And so right now it's sort of like, I guess I would call a value-based point.
Okay.
I always use program in quotes because it's not really acting like a program. It's really just acting like a financial
It's
benefit.
confusing because the general assistance it gets lumped, there's general assistance,
Yeah.
which is a program, and
Yeah.
general assistance emergency housing, which is a
Yeah.
benefit.
Right.
So, and they get used interchangeably, but they're not.
They're not the same
Yeah.
thing. Yeah. As Katie was saying, it includes, emergency burial services. It includes, fuel assistance, right? So, we will most likely, I'm not predicting it, but I'm saying that it might go this way, create something that doesn't have general assistance in the title. And, when we look at that bill, we'll, be very distinct about separating it out. Because it causes a lot of confusion.
Absolutely. And
Yeah.
in the reports themselves, they do say program after housing.
Yeah.
Program. So maybe in future iterations, we can just pass them. If that's something that we want to do.
Well, yeah, and I think that you will, as we discuss whatever number of the bill that it comes out,
Yeah.
as we discuss that, we will definitely keep in mind how we label it, how we title it, and where the appropriation goes. Yeah, for sure. It's, the history behind it is varied. I mean, it took on a great deal more importance during COVID,
Yeah.
and a great deal more resources went to it. Prior to that, it was really relatively small. Even the cold weather aspects of it was relatively small. And, we're spending $55 million on it now. And that doesn't count the other shelters. That's just this part of the program. So, we're going to take a comprehensive look at that.
Okay, I'll continue on. The next item is the September iteration of the GA Emergency Housing Report. And then there was a requirement for a October status update on the Burlington Overdose Prevention Center.
Then we have the annual Global Commitment Investment Report. Global Commitment Investments are things were allowed under our section 1115 Medicaid demonstration with the federal government to spend or to get Medicaid matching funds for that otherwise would not be Medicaid matching fund eligible.
And of importance to this committee is, last year, we authorized the use of Medicaid funds for Meals on Wheels. And the Meals on Wheels are going to be paid for under this investment category. So that is something to take a look at to see if they actually start showing up there. Yeah, go ahead, Doug.
And so anything this committee would authorize, as did last year with Meals on Wheels, is already permissible under the federal language.
In this case, it was.
And the state is just deciding, or we're deciding that we will use it towards that
Yes.
aspect of it.
Yes,
Okay.
and so we had, how many attempts did it take us, Dan? I don't know, maybe 3, I don't know, but we tried a few different tacks to first we got $1 million of state funds into Meals on Wheels because there was 0 state money going into Meals on Wheels. It was only under Older Americans Act, federal money, and way insufficient. And that became really clear again during pandemic. Pandemic really shined a light on a lot of things that were an issue. And so we were able to get $1 million appropriation state funds. And then the following year, which was last year, we had been trying to get AHS to look at federal funds because we knew that they were eligible for federal funds to match. And so they agreed last year and are in the process of putting that money out under an investment. So it's already, there's sort of a category of broad definition that we have with the federal government under the global commitment. And this fits under that broad category. So somebody listening from AHS will correct me if I'm wrong, but if it fits under that broad category and it fits under the allowed amount, then we don't have to ask for permission again. We can start to claim it. So, and then how it gets out to the meal sites is another whole different, that's another whole different process. And what kind of documentation that's required and how efficient are we in getting the money out to the meals and the meal sites that are out there? What method do we use? Do we use the AAAs? Do we send money directly? And all of that kind of stuff. So we'll be asking those kinds of questions.
Great, thank you.
That's on our Meals on Wheels. It's on our O&A agenda.
But there are pretty strict parameters around what we can use global commitment investment
Yes.
money for.
Yes.
So it's not.
It's not just anything.
Right, it's not just what the state chooses, and there's a cap on what we can put into that bucket.
The interesting part is that you don't necessarily have to be Medicaid eligible to receive the benefit of global commitment investments.
Across the board, not just specific to Meals on Wheels.
That's correct. Right. So the nature of it is the concept behind it is that you're avoiding, you're attempting to avoid through these investments, having an increased number of people qualify for Medicaid, essentially. So if you can meet their needs in a smaller targeted way, then, theoretically, they may not need to apply for Medicaid benefits. So under the investment category, which as Jen said, has a definition that we've agreed to with the feds and a cap. But we get to make some decisions about, we as a state get to make some decisions about what we cover under that. So, and last year we were successful in getting them to think about Meals on Wheels as one of those options. So.
So at the top of page 2, the next report is the October iteration of the emergency housing update.
Yeah, okay, next we have the choices for care noticing, few of these still say 2023 from our,
So that looks like that was the last time a quarterly report was submitted.
and that one wasn't submitted either. It's not hyperlinked. So we haven't seen
Oh, that's the due date. It says submitted, but so I didn't.
let's say, I think that must have been from.
Carryover.
Yeah, carryover from last year.
Okay. It wasn't actually submitted.
It's not actually submitted.
Okay.
Nope, we'll delete that word.
Next was the second of the two progress reports on the emergency shelter permanent supportive housing. And then there is the PFAS implementation plan that we talked about just a little bit ago. There is an annual report from the Agency of Education on after-school and summer learning program grants that was due to be in last November, so you haven't received that one yet. The final report of the Psychedelic Therapy Advisory Working Group came to you in November from the Department of Mental Health. Next is also from the Department for Children and Families, came in November. This is the reporting and storage of interviews and child abuse and neglect investigations. And then from the Cannabis Control Board, recommendations on the medical cannabis registry. We just talked about the competency restoration fiscal estimate that came in November. Then you have the November iteration of the emergency housing update. There is an annual report from the health department team, from the health department, from the child fatality review team. So this is a group that looks at unexpected child fatalities throughout the state and makes recommendations and observations based on what they have reviewed. After that is the annual report of the Child, Youth, and Family Advocate. That has yet to come in, but I believe it's supposed to be coming in shortly. And then last on this page is the plan of the Pre-K Education Implementation Committee. And this came in November, so I guess as you all maybe have an interest in that one. Oops, page 3, we're cruising along. Okay, this is the November iteration of emergency housing. And then you have another update on the status of grants to the Burlington Overdose Prevention Center that came in at the beginning of the month.
That's the one that was also in the report that you, in the previous presentation that you heard about last week.
And then there's an annual report. There's a standing substance misuse prevention oversight and advisory council. So there is a standing annual report from that particular group. There is an advisory council on child poverty and strengthening families. It's a mix of legislative members and non-legislative members. They did meet, this group met, I think, 3 times.
We're 2 times. The
2 times.
last one, I'm the chair of that. I was very sick and in the hospital, so we had to reschedule. We're working on an email method and then having a brief meeting to finally get our recommendation. So it's coming, but we'll be late.
In the prior year, it wasn't active. It didn't meet
Like for a few years.
Yeah.
Yeah.
Since COVID, I think.
Yeah.
Yeah,
Go ahead.
Sorry. Do either of you or you as chair know the Strengthening Families, is it the state program Strengthening Families or is it just? Because
No,
it's not.
It's
okay.
like the conceptual,
So
how do we
strengthen
part
families generally? Okay.
of how we like
It's not
end
this specific
child
framework.
poverty is
Okay.
by strengthening, our families.
this committee with the Senate Health and Welfare Committee back a few years ago. I mean, I was on the committee, so I don't know how many years ago, but we changed the name of it. We had a bill that we passed like when Ann was here around the
other Ann.
ACEs and all of that kind of stuff, and we changed the name. The other Ann.
The prior Ann for new members.
There was another Ann?
Yes, the prior chair before me. Her name
Without an E.
represented you.
Without an E.
Yeah.
Right.
So
Okay,
we
thank you.
just, it was broadened at that time to represent the concept, not a particular program.
Next was an appropriation to expand high quality mental health and substance use disorder treatment professionals. This report was supposed to be due until the funding ran out. As you've not received it, I wonder if the funding has run out, but that would be something to follow up with the agency about.
Next is a report from the Department of Vermont Health Access on whether changes should be made to the V-Farm program which is a pharmacy, prescription drug benefit for older Vermonters, to align with some expansions to eligibility for the Medicare Savings Program that happened in last year's budget.
And then, in the budget last year, there was a creation of the General Assistance Emergency Housing Task Force. One of the chairs is here, your committee, and that report has come in. I believe you've maybe even already heard about the report.
Next
Next
week.
Oh, next week. Okay.
Next is 2024 tobacco retail audit. It was supposed to come in from the Department of Liquor and Lottery. There was language in last year's budget bill that asked them to, in addition to reporting their usual information on tobacco, sales of tobacco products, tobacco substitutes, tobacco paraphernalia in retail settings, to also talk some or address sales of alcohol in licensed establishments.
There is an ongoing annual reporting requirement asking the Agency of Human Services to provide an inventory of all grants from the previous year. So that has not come in, but that is a requirement. And similarly, there's a Commission on Alzheimer's Disease and Related Disorders, and they have an annual standing reporting requirement. That was due January 15th. Another standing annual requirement is the annual report of the Human Services Board. This has things like the number of fair hearings from the previous year, the number of decisions issued. That has come in. There is an annual report from the Health Department on Community Violence Prevention Program. And this discusses what grants were issued, how they were used. That has come in.
Yeah, go ahead.
Sorry, I'm going back a little bit. The inventory of Agency of Human Services grants, that says it's an annual report.
Yes.
So would, like previous years' reports should be there?
I mean, in theory,
They
Yeah.
submitted.
You have to
if
go
they
back
were
a ways.
submitted, yeah. It could have been many years at this point, but I don't know. We can look in the data, the reports
I
page.
have looked. I will look again. But
Yeah.
I think I did not find.
It's, I will say it's a, practically impossible thing to do, which is probably why, we have not received the report and.
But it kind of highlights the
It does,
challenges with,
it might be good to take a look at the legislation that originally asked for that and under sort of what circumstances that was.
And I should restate, because I'm going back and looking now. They do have something posted for the last several years. They are with the reference to the same statute. So I think it's the same thing, but they are calling it improving grants management for results-based programs. And it is not quite the level of inventory, although the language itself.
Is the language from the bill?
Yes, so it uses.
Okay.
I guess they do have a link. Please refer to statewide grants information available on the Agency of Administration's website.
Is that 2025?
That's 2024, but so it's not fair for me to say it hasn't been done in years because it is.
Okay, so could you maybe update this and put that link in here? Do you think
That wasn't 2025, that was 2024.
so only current reports.
But it's sort of a report with a link in it to where they put the inventory. So,
Okay,
but it's still, we don't have the most current.
okay,
But I'm happy to send Lori a link to that.
all right, yeah, that would be helpful. Yeah, go ahead.
Now, when you say they come in, who do they come to? I like to know the whole thing.
Yeah,
Nosy.
so there are instructions on the website for agencies or other entities that are submitting reports about how to submit a report. And it's on the reports tab of the General Assembly's website, so it comes into a main email address that collects reports, and then there is a person who works for the General Assembly who posts them on the website.
Thanks, you. Legislative reports at ledge.state.vermont.us. It's the,
Okay.
as Katie said, dedicated
And
website.
We are often notified as committee chairs that reports come in. And sometimes the sending department sends it to us at the same time that
Oh,
they send it there.
Okay.
But, and then, the person responsible also lets us know. So sometimes I get several emails regarding the same report, but, and then, the creation of a report or the creation of an obligation to submit a report is done in legislation. So you'll see, Probably, when we work on a bill, there might be a report that's required or not required, or we might modify something that exists. So those requirements, come in legislation.
Okay, next is an annual report from the Department of Health, the statewide prevalence and incidence estimates of amyotrophic lateral sclerosis, ALS. Top of page 4. There was a piece of legislation, I would say 3 or 4 years ago, on health equity that created the Health Equity Advisory Commission, and they have an annual report that comes in every November. Similarly, that legislation required the Department of Health to do a statewide analysis of health equity data, and that is what the next report is.
Then there's an annual report of the maternal mortality review panel that looks at deaths of pregnant individuals and deaths within 1 year postpartum.
Next is a Department of Health annual report on lead poisoning prevention in young children. There are requirements for lead testing in young children and prevention recommendations, and that is part of this report. Next, the Opioid Settlement Advisory Committee is required to present their recommendations for expenditures from the Opioid Abatement Special Fund every year when the budget is presented. So that is what that requirement is.
Can I ask a question? I know it says presentation only because I remember this discussion. They've actually submitted a letter, via the health department with their recommendations.
Mhm.
Do you think that seems like that would qualify?
I think it's not uncommon for a presentation to be requested and then there's sort of a written work product to go with it.
Okay.
I don't think that precludes you from having them in to hear more
To hear
details.
more,
information.
Yeah, okay. All right.
Next is the implementation plan. Implementation of a plan for developmental disability services. This is an annual report that comes every January. You haven't received that one yet. There is a deaf, hard of hearing and deaf blind advisory council, and they're required to submit an annual report, and that hasn't been submitted yet. And then we have an annual report on the distribution and use of supplemental childcare grants. And this is from DCF, and you haven't received that one yet. Or at least it's not on the reports page. Maybe Lori has received it, but it's on the reports page. There were a number of them. It's okay. Don't worry.
Yeah, we haven't received the DD one, the deaf blind one. I feel like I have just seen something about supplemental childcare, but
Okay,
it's only relying on my memory, which is not a good thing.
okay. Building Bright Futures. This is one, I think of 2 Building Bright Futures reports in here. This is an annual report, accountability and monitoring transitions in childcare, pre-K and after school systems. So you've received that. Oh, yes, sorry.
That's okay. This is from the Department of Disabilities, Aging and Independent Living, and this is a report on implementation of the state plan on aging, which is something that this committee had worked on a few years ago in creating an older Vermonters state. And part of that effort was to have a state plan on aging to make Vermont an age-friendly place to.
I was gonna say it has come in. I read it. Okay, thank you.
Also, we have a report of the vulnerable adult, can't say it, fatality review team. This is a report from Dale, again, they look with all of these fatality review teams and maternal mortality panel. They typically look at deaths in certain populations across the state, but also do kind of a deep dive on 1 or 2 of them to look into the circumstances and see if there are any patterns or any issues with the system of care that would indicate changes need to be made, and then bring forward recommendations. Then we have an annual report on complaints, conditions, and quality of care in long-term care facilities. This is really the annual report from the state long-term care ombudsman, and that one has come in.
You have a report, an annual report as part of the budget presentation from AHS on homelessness, emergency shelter grants and management. I'm wondering, I'm just looking if this was from the 2011, 2012 budgets, and I'm wondering if that's part of the budget presentation, but I'm just wondering if some of the more recent budget language around shelter development,
Supersedes that.
yeah. Sure. Okay. Page 5. There is an annual report from the Agency of Human Services, Health Department, and Department of Vermont Health Access on the Substance Abuse Treatment Services Delivery Program success. I've not received that one.
Next, we have the annual report of the Adult Protective Services Program in the Department of Disabilities, Aging, and Independent Living. That one has come in.
In the 2022 budget, you asked for proposed policy changes related to the STARS program within the Child Development Division. This was a presentation as part of budget adjustment. So you may wish to inquire about that this year.
As part of their budget adjustment presentation, the Agency of Human Services is directed to give an update on the status of rulemaking for the new unused prescription drug repository program. There's rulemaking happening as a result of legislation passed 2 years ago, I believe, that creates or authorizes the agency to contract with an outside entity to collect and redistribute unused prescription drugs under certain circumstances. Then we have the annual report of the Palliative Care and Pain Management Task Force. That is a report that the Vermont Ethics Network spearheads annually, and that one has come in.
Is that different than the hospice report?
Yes, the hospice report is generally about deaths in various settings, including hospice.
Okay.
This is
Good one.
so yeah, 2009 report that requirement that was not necessarily required to be an annual report, but this group has continued, I believe, to meet and to report its recommendations.
Yeah, I just did read this Ethics Network one. They actually address hospice in there as.
They do, I mean, hospice is a type of palliative care,
Care,
so it
yeah.
makes sense, but it's not.
Yeah, Lorraine, Lorraine, I know Lorraine's.
I don't know what palliative means.
Palliative care is comfort care, so sometimes when somebody has a long-term or terminal illness or other kind of enduring condition, it's to make them more comfortable, yep, so
Right.
physically,
I learned
mentally,
something new.
psychologically,
Nice.
yes.
Provided lots of times by our home health agencies.
Yeah.
In people's homes, lots of times are in residential care. It's at a point where you're not seeking to cure the person's
That's
illness.
hospice.
So if,
At hospice, right.
Hospice. Palliative care is a
It's broader.
broader comfort care.
so it's like a different organization than hospice? Or is it
Palliative, so
same?
neither of them are necessary, it's just different provider types can provide these types of services. So depending on kind of what stage of someone's life and sometimes what the payment parameters are from the various payers may depend
Which
what's
care they
eligible,
get.
which providers can
Okay.
provide it.
Yeah, never
and what
heard
it's
of it.
called.
The next report is the Forensic Facility Population Data. This is an annual report for, time-limited annual report from the Departments of Mental Health and Dale, meant to collect data, sort of if there was a forensic facility, how many persons in the department's care and custody could be served there. Next is
Can I ask a question about that one? So is it only, did that say only under the conditions that we created a forensic facility? Or was it that the people who might be eligible for a forensic facility, if there were one?
I think eligible if there were one. I would have to go back and look at the
Okay.
language, but I'm looking that this was 2023. That this was requested, so this
Well,
was,
that was
Who are the people?
right. That was because we squelched the creation of the facility and we had this compromise.
right, I think this, I guess what I'm thinking is that there was a sort of a thought at the time that maybe this was part of an ongoing conversation, and if there was more data, that would be used in 24. So I think that's probably where that's coming from.
Okay.
Representative.
Oh, I'm sorry. Go ahead.
What is a forensic facility? This is,
So let's talk, let's talk a little bit offline. It's, yeah, we'll talk about that offline, yeah. And
I can
it's-
talk
Can I
with you.
write notes and then you'll help me?
That's an
We'll
excellent,
meet after, yeah.
excellent
I'll write
idea.
notes.
Keep notes of things that you
I
want
want to
more
ask
information about.
questions.
Yeah,
Good idea.
because
Forensic.
you will find every day in this committee, we all learn something new. So,
I'm learning a lot.
write them down and, that's good.
I'll ask my mentor.
Okay, next is a BAA presentation from the Agency of Human Services on unobligated funds remaining from the Emergency Housing Transition Benefit. This was the Act 81 language that we talked about after COVID, moving people who had been receiving sort of the COVID benefit into the traditional GA program. So that is from that. Next, we just talked about the recovery resident certification proposal. So that is due from the health department and that has come in. Also from the health department, this is an annual report requirement from 2025 through 2029. Overdose Prevention Center and pilot program evaluation. Then there's an annual report on from the Agency of Education Department of Children and Families on an evaluation of pre-K programs. This is in section 829. So this is like the universal, the 10 hours of pre-K. That's what that is referring to.
And we haven't received that, it looks like. I mean,
Yes, that's true.
Sure, and has-
was there one in 2024? Do you know?
I'm not sure, but I reached out to the health department, not to the health department, to the Agency of Education about a few reports. And I think they're behind is the sense that I got. So because you haven't received it, doesn't mean that you maybe won't receive it. You should expect at the end of this month, a report from DCF on the REACH program. That is the annual report.
Let's see, maybe you did get the one and we just didn't recognize the name.
No,
That's something
that
different.
is something different.
Okay.
Yeah, no, that's okay. Second, Building Bright Futures Council. The State of Vermont's Children Year in Review. This is due the first January of, it's due every other year. The January of the first year of the biennium.
I think this is out.
Yeah, I think it's.
This is out.
Is it on the website or?
I don't know if they actually fully submitted it, but it's been out for public.
Yeah,
They did a presentation.
And a couple of Mondays ago, they had. the presentation.
Building Bright Futures is listening. The submission instructions are on the website under the tab reports.
Well, they will be here, so we will.
Okay,
Next, we have the first, that status of recommendations for re-envisioning the Agency of Human Services. This one is the one that's either a report or a presentation, and it's supposed to come in by February 1st.
next is, you should expect another quarterly update in April on the Burlington Overdose Prevention Center. And then we get into a list of reports that you really should expect after, well, hopefully after adjournment. I hope you're not still going in July, but who knows?
So the question for you, Madam Chair, is do you want us to go through these, or do you want to just know, some of these are just helpful for us as we're putting the reports list together to help populate next year's?
I don't think we need to go through them. I think,
Because a couple of them are sort of ended up with two.
some of them are continuing, like, we know that the re-envisioning AHS will come in November and, 2021, some of it's, it is interesting, some of the ones that are, from like the evaluation of early childhood workforce programs. 2021, that was put in 2021, so I'm presuming that it's an annual thing.
Where evaluation of early childhood workforce programs. Act 45, was that the childcare financing bill? That was the precursor for Act 76.
That could be.
That would make sense that you are looking at having this information sort of to tee up future work.
Yeah. So I think it's helpful for us to see these, then we can go back and look and see, and thank you for the citation. So we can go back and look and see, like, is this something we really are going to need on an ongoing basis, or is it like something has superseded it? And if we also, for members, we also, I don't know if we will this year, but in the past, we have received from House Government Operations a list of reports due to our committee, and they will ask us if they need to be, if they can be eliminated, if they need to continue. I don't think they have a 7-page list for human services, though. The last time I looked at it.
They're up for, so they're under 2 VSA section 20.
Oh, it's a rolling.
Right, after a report has been going on for 5 years, it's supposed to be sort of flagged for
Oh,
review
okay.
if it's an ongoing report.
So
So
we'll get
it wouldn't include your one-time ones, it would only include the 5-year, ones that have been going on for 5 years, unless in a previous iteration, you either said, yes, we always want to get those, or something. So some of them you flag when you review them and say, ask us again in 5 years. Some of them you say, no, we don't want these, and some of them you say, yes, we always want these.
Can I just add to that, just because you've checked the box that says you don't want to receive that report anymore, other committees may have checked the box to say, we do still want to receive it. Or if, it has to be actually repealed in a bill. So if GovOps doesn't end up doing a bill that repeals reports, then the fact that you've checked it off is just information they have, and the report is still due.
I guess I should ask about whether we
I
should.
checked in with the attorney who usually works on that, and he was under the impression that they were going to be doing a report repeal bill. I know the healthcare committee is also very interested in getting rid of some reports that they.
I remember last year checking off several that we didn't need
That don't
anymore.
need,
Yeah.
the agency to work on them if people aren't interested in continuing to receive them.
Yeah. Anna Munray.
Just a note on that. I mean, there, often when that discussion has come up, it's pointed out that we can always ask for the information to be presented, even if there isn't a report.
Mhm.
The downside of that is that we sometimes forget that we still want to know. So that's a heads up on our work group's budget topics.
All right.
My question was answered.
Oh, okay. All right. Thank you both so much. This was a lot of information.
So I had a question about a couple of them. And maybe I missed it on the list, but it was a presentation. Maybe it didn't have a date on the rare disease from the Department of Health. I'm sorry if I missed it because I stepped out, but it was in the statutes and
Yeah.
maybe we didn't ask.
One time, I think I'm gonna have to look it up. I don't know. I think it was the answer. I have to look, but I will.
Okay, thanks.
Yeah.
And the other one was, I thought that we wanted anyway, Green Mountain campus, Red Clover, et cetera, updates, that we didn't have anything in any statute, I assume.
Doesn't ring a bell to me.
Yeah, okay.
Can you give me a little bit more context?
Yeah, what-
Secure, lockups for juveniles.
Oh, so this isn't the psychiatric treatment facility
No.
for youth. This is, like population that previously was served by Woodside.
Exactly.
Um,
We had been getting them and maybe it was time limited and.
I don't know.
Okay, thanks.
All right. Thank you both very much. Gives us a lot of all in one spot, and it's a place for members and your budget teams to look at the reports that are due from your departments to see if we've gotten them, to take a review of them, and it can help inform our questions during testimony, particularly on the budget, but also on any policy issue that we might take up. Like for instance, on the APS stuff, I know there's going to be some sort of cleanup bill coming from someplace, so looking at APS report would be helpful as background information. So thank you both very much. I know that was a lot of work to pull that all together, and I'm glad you're able to make use of it in more than one committee. So
we like to do Senate Health and Welfare first, because then we can just revise this.
Thanks a lot. Appreciate it. Okay, so now folks, we are going to be breaking shortly. You're going to have time the rest of the morning to work on your budget essentially your presentations to our full committee, which will happen later this afternoon. I want to be clear about expectations. I am expecting something in writing from you, so that I am able then to, after we have a discussion, to pull it all together and put it into one memo that's going to go to appropriations. I'm going to encourage you not to use a lot of words, too many words.
One page isn't too.
One page
Really
might be
good.
too many, just for your section, it might be. We want, just remember, this isn't the budget, okay, this budget adjustment. And we also want the appropriations committee to take what we put down and to, use it. So I think that as concise as we can be, with still getting our recommendation across is what I'm hoping to see from folks. And so, and we will use a process this afternoon where each team will report out on their recommendations. First, report out on what are the major things that they saw in language and what are the things that they saw in the sort of ups and downs list. And then to give us your recommendation about what we do with that information. So do we say it's okay as presented? Do we say it's okay with this modification? Do we make a recommendation that those funds be utilized in a different way if there were funds that were being returned? It's not a place, remember, to make a brand new recommendation around creating some new program or something, okay? And it's not a place to say we shouldn't do something that's already been approved in statute, okay? That's another thing to not put in this memo. Then I will take your we will try to reach consensus on everything. If we can't reach consensus, then we'll do a straw poll. That's the process we will use for including or not including the recommendation in a memo from our committee. Once it's written in a memo from our committee, it is our committee's recommendation, and that is the information that goes forth to the appropriations committee. It will be posted on our website. This afternoon, you can expect other advocates to be sitting around the table outside the table here, as you present your recommendations, because they watch our agenda and they are interested in knowing what we are going to say to the appropriations committee. And then I don't know if they will follow the same practice as they have before, but the last several years, the chair has gone to the appropriations committee to present our recommendations and essentially the rationale and answer any questions that the committee may have about our committee's recommendations. So the appropriations committee takes our recommendations very seriously. We have been very successful in the last 2 years around the recommendations that we make. And, it's important. What we do in our memo to appropriations is important. That being said, anybody have any questions about that before we go off live?